Welcome to Healthcare Headlines. I'm Amber Walsh, Chair of the McGuireWoods Healthcare Department. Today, I'm joined by two McGuireWoods colleagues, Wendy Wright and Tim Fry. Each of Wendy and Tim spent a significant amount of time in 2020, the onset of the pandemic, and throughout the year, assisting clients with funding and regulatory changes related to COVID-19. And that guidance was really the genesis of our original video series that we produced on the fly very quickly as a method of disseminating very quickly changing information that healthcare providers needed as we were starting off the pandemic and as those federal interventions, those relief programs were rolling out and evolving. Since then, each of Wendy and Tim have continued to be true leaders on the McGuireWoods team, continuing to guide clients throughout 2021 on significant rounds of funding, which Wendy will talk to us about, and on a series of legislative changes from the CARES Act to the American Rescue Plan and the associated rulemaking, which Tim will speak to us about. We will be revisiting some of that rulemaking and how the programs are evolving in future episodes of Healthcare Headlines. But today we want to really focus on these COVID-19 related federal interventions, two in particular, the Provider Relief Fund and the American Rescue Plan. We're really focused on how these support systems directly impact healthcare providers. So, Tim, I'd like to start with you. Can you help our viewers by just understanding some of the nomenclature? The interplay between the Provider Relief Fund, the CARES Act, the American Rescue Plan, all the different words and languages and laws kind of run together. So if you can set the stage from a nomenclature standpoint, that would be a great way to get started.
That would be great, Amber. And it's been confusing for our clients throughout the year and us as attorneys because the nomenclature has honestly changed. The CARES Act was the second major piece of legislation, but it was the first real large one that came after kind of the scope of the pandemic and crisis was really known. It established money for providers that then came out in April. It was April 10th when people just had extra money show up in their bank account. And that is now known as the Provider Relief Fund. It was supplemented by additional funding a little later when they did kind of the second round of PPP. They put additional money into the Provider Relief Fund. And that's why we call it that. It was for a while known as the CARES Act funding, but that went away because they kind of kept putting more money. That got us to $75 billion in the Provider Relief Fund that Wendy will talk about, and then later appropriations had another $3 billion in that. Congress passed a couple more pieces of legislation. Meanwhile, Health and Human Services, HHS, was putting out these phases that Wendy will talk about, I think, a little bit of the Provider Relief Fund. And that's what we call them, phases, because HHS has used that terminology. They first called them rounds, then they called them, tranches, or maybe we call them tranches, but then phases. And so that's kind of the nomenclature. Congressional action to date has included omnibus appropriation acts as well, which we're not going to spend a lot of time on. And then the most recent is kind of the American Rescue Plan that was the first major piece of the Biden administration's response to COVID-19, passed with only Democratic votes in both the House and the Senate. And it's at least the fourth major piece of legislation that the Congress has passed, leading to, multiple trillions of dollars spent in response to the crisis.
Very helpful. Tranches. I love that word.
Tranches.
That's a word that only a lawyer would grab onto and use. All right, Wendy, we are going to start by talking a little bit more deeply about the Provider Relief Fund. So Tim set the stage for us and the nomenclature and kind of the history over the past year. But why don't you give us that brief overview, please, of the Provider Relief Fund exactly what it is that we all started to tackle anew, roughly this time last year.
Okay. So like Tim alluded to, lots of different names, phases, tranches, general distribution. So I'll just go over briefly, just kind of set the stage for what is the components of the Provider Relief Fund. So the fund was essentially established just to reimburse healthcare providers for expenses and lost revenues attributable to COVID-19. And then to date, the federal government has actually allocated $178 billion worth of payments to be distributed through the Provider Relief Fund. The payments have been made in the form of 3 phases of general distributions, which were first dispersed in April of 2020. There have also been targeted distribution payments to certain healthcare providers like safety net hospitals, rural hospitals, tribal hospitals, skilled nursing facilities, and then also to reimburse providers for COVID-19 testing and treatment provided to uninsured individuals. So initially, the distributions were limited to Medicare fee-for-service billing providers, but the list of providers who were eligible actually expanded to include providers such as Medicaid, CHIP, dental providers, nursing homes, assisted living facilities, and those changes came about in phase 2.
Yeah, it's easy to remember what it felt like a year ago when people were so desperate for the funds and so desperate to understand, did it apply to them? It was an incredibly daunting time. And to say to clients and other stakeholders who were clients that we were just trying to help, just wait. You've been provided for, it's going to be a couple more weeks, just wait. It's really a very challenging time. And I know that you and Tim also experienced that, as many of our McGuireWoods colleagues did. Any particular challenges that you want to describe that providers experience, not to kind of go backwards, but really to help people kind of think ahead for what's still to come? So the challenges, maybe, Wendy, you can describe a little bit.
Of course. So I think the biggest challenge is that the Relief Fund program has really been kind of a living, breathing, evolving program. So Tim pointed this out earlier, but kind of requirements were changing daily. And I know that even just on our end of things, it was hard to keep track of what are the requirements right now, and they would change 2 days later, and sometimes they would change just kind of sporadically and without warning. And so I think the biggest challenges providers face was, what are the requirements to receive this money? Am I eligible? And kind of what am I attesting to or agreeing to if I actually keep these payments, and what kind of strings would be attached? So I just think understanding the program, and as you both said, when this money kind of showed up in people's bank accounts, they really just didn't know what to do. And it was a little bit unprecedented that the government would just start handing out cash to folks without really telling them what was the basis for that money.
And if I could just chime in, because I agree entirely with what you said there, Wendy. HHS was trying to respond to what Amber spoke to, of kind of a general sense of crisis. How are we going to keep the doors on? Clients in states like Ohio that very early on told, non-essential healthcare providers, close your doors. Well, are we going to lay off our entire staff? How quickly can we get back and up and running? And all credit to HHS for putting out the amount of money that they did so quickly, and Congress for including it in multiple rounds of appropriations and in spending. But there was not, the final answer. What is this all going to look like? Because HHS was trying to develop it over time, and they were responding to multiple rounds of legislation as well that changed the rules. And I think you spoke to it very well. A lot of clients had that uncertainty, but it was because of how quickly people were trying to move to support the industry.
So a lot of those challenges are in the past, right? Deadlines have long passed many months ago to keep the funds or return them, right? We can't go backwards and reassess. Those decisions were made. We all look forward. but there are still some challenges with the provider relief fund. So Wendy, any particular ongoing challenges that you want to talk about?
Yeah, I think right now the ongoing challenges is the reporting requirements. So we got some instructions, a first round in the fall, and then we got a second round of instructions towards the end of the year. And now we're kind of in a holding pattern where HHS has said more to come and has actually gotten rid of the deadline for submitting reporting information. So I think there is still some uncertainty as to what exactly needs to be reported. How long will providers have to gather and collect that information once things are finalized? And then I think on the same token, there are many more providers due to the amount of money that was given out in 2020 that are now going to be subject to audit requirements. And that's something brand new for a certain group of providers who have never had to do a single audit requirements. And so I just think there's still just some uncertainty around reporting and quite frankly, some uncertainty around whether or not people really got the right amount of funds and have used them appropriately in 2020.
So Wendy, obviously it can be really confusing and it's daunting to keep up. We do our best to keep all of our clients and stakeholders informed, but it is certainly not unprecedented, even pre-pandemic, for reporting deadlines to change and standards to change. What's your recommendation for providers on how to be fully up to date? Is there a place they can go? Obviously, they can call us, but what is your best recommendation?
Yes. So there is a website. So hhs.gov/coronavirus. And then on the left side of the page, you'll see a link for a provider relief fund. And I would say that's the most up-to-date place to get information. It's got everything split out by providers for patients. And that's the place where HHS has been continuously kind of just keeping everything up to date. And as things change, I would just recommend every couple days as we get closer to the reporting deadlines, I would just check out those pages and see kind of what new information is there.
And Wendy, you still, I know I still have a habit of hitting reload every day. I know you're probably the same way.
Absolutely. Go ahead.
Yeah, and for the truly paranoid, a little inside lawyer's tip, you might want to screenshot because it'll give a date on the bottom. So you'll be able to prove I got this information on this date at this time. And that is how I, as a provider, made my decision, also in consultation with my lawyer, et cetera. But it's really helpful because it's serious. And while we all expect there to be some significant flexibility for providers who are just trying their best to interpret, we also know that there's already been enforcement. And so far, the enforcement has been in pretty extreme situations. We saw the first enforcement action on misappropriation of funds a few weeks ago. But Wendy, talk to us about that. What are we already seeing in enforcement actions? What do we expect to see regarding providers' use of keeping provider relief funds?
Yeah, I think what we've already seen is actually there have been two enforcement actions. One was just announced, I would say this week, and then a couple of weeks ago. And what we've been seeing is that providers who were kind of already in trouble with HHS, either they were kind of being investigated for overpayments or some other kind of misuse of HHS funds, they've kind of been tacking on kind of just another thing to their investigation. And that has been like, have these providers received funds? Were these providers actually up and operational in 2020? And I think a similarity between the two investigations that we've seen so far is that both of those providers received funds based on 2019 Medicare fee-for-service payments. And then HHS realized and noticed that, okay, but you weren't actually up and operating. We know, for a fact that you were closed. So where their thinking is that, they're not using these funds appropriately. And I think for right now, we're just seeing kind of the most egregious cases where funds were given to relatives, and then those relatives did what with the funds, who knows. But I think moving forward into the future, especially with reporting requirements coming up, I think there will be kind of just some data mining on behalf of the government to make sure that providers were using funds appropriately. And I think an easy catch is to look for those people who were billing for services in 2019, didn't bill for anything in 2020, and there's going to be a question as to whether the funds that were received and kept were actually used appropriately.
Yeah, the low-hanging fruit, right? Of course, right?
Absolutely.
And that's what they have to go after first, right? I mean, it's integrity of the funds, where they were intended to go. So with this talk of enforcement, is it too late for providers to address any compliance concerns they may have for payments received through the Provider Relief Fund? Anyone who is still a little bit nervous that I don't know, is it too late for them?
I would say absolutely not. I think the government knows, as well as the providers, that all of these things happen so quickly. And while providers were receiving payments, they were also actually addressing a pandemic at the same time. And so I think that if you have funds right now and you feel like, now they've had time to think and breathe, and we're kind of, coming around the corner on this thing, that some things either you weren't eligible, or maybe all of the funds that you received shouldn't have been used, I still think there's an opportunity to contact HHS, with the help of an attorney, and just try to give back those funds. I just don't think it's too late for that. I still think there are mechanisms in place to give back any money that you received, so long as you're doing it in good faith, and you can, honestly say, I got these funds, they should have been in my bank account, not trying to do anything nefarious, and I just want to make it right and give it back. I think that's just an easy way to address it.
And to echo your comments there, Wendy, HHS has said that when they put out their final reporting rules, and once you have to submit your final reports, there'll be an opportunity, if you can't validate everything that you will submit in your report, that there'll be an opportunity to give back funds. So there's still a process to come. And so I agree with you wholeheartedly, is if you have those qualms out there, please speak to your attorney, call us, think through it, and we can, make some steps in the right direction to try to make sure you feel the most comfortable moving forward.
Yeah. So let's shift a little bit from the Provider Relief Fund. Let's talk about kind of the second big topic that we wanted to cover today for healthcare providers. Speaking of cash for providers. So Tim, you're going to talk to us a little bit about the recently passed American Rescue Plan. So we know that the ARP is providing the much talked about $1,400 checks. It extended unemployment, gave lots of money for states. After multiple legislative efforts to get here throughout late 2020. Is there anything in there for healthcare providers? So kind of give us the overview of the ARP as it applies more specifically to the healthcare provider community.
Yeah. So the biggest thrust for the healthcare industry overall was insurance expansion, and we'll come back to that. That's not directly for providers. The second big thrust is, COVID related vaccines, testing, treatment. Then there are some changes that are pretty in the weeds for Medicare and Medicaid providers. But, if you're the right type of provider, that's going to really help your funding. So all urban hospitals in a state that only have, that don't have any rural hospitals, they get a floor so that they get higher payments. There's some tweaks to how Medicaid payments will work with mandatory minimum payments. So there's some tweaks there. And then there's a lot of spending on mental health, veterans, Indian health care, rural health care. So, depending on which category of provider, there is some substantial support and, thrust and financing for the provider community in addition to what's being done for the healthcare industry at large.
And those insurance changes, are they permanent? Talk to us a little bit about that.
Well, they're not. They're not permanent. They are the largest health insurance expansion really since the Affordable Care Act, and they come in a number of flavors. So there are 12 states across the country, or about 12, that haven't expanded their Medicaid program to low-income adults. There is additional money. Originally, the Affordable Care Act was going to cover 100% of those costs, and it kind of phased down over time to encourage those 12 states to stand up a Medicaid program for low-income adults. They put a lot of money there, basically making it 95% of the cover costs federal. So that could potentially, if some of the holdout states expand with that could be a big thrust. The second is anyone uninsured last year gets COBRA for free. So if you were receiving uninsurance benefits last year and into this year, you'll get COBRA coverage through the fall free, no premiums, and COBRA, I think, is both of you would attest to, is not cheap. It's usually covering the cost of what your employer would have spent. So the federal government's picking that up. And then on the Affordable Care Act, kind of the marketplace piece, there is a substantial increase in subsidies. And without getting into all the details, there was, kind of maybe a flaw in the development of the subsidies for insurance premium support, such that, a middle-class family, making, 3.5 times the federal poverty line, basically lost federal support after receiving quite a bit of it, and now they're mandated to get health insurance coverage. Well, there's now support all the way up the income ladder if you're getting the exchange plans, and everyone in all the tiers are going to receive a higher premium, including a larger portion of the population that will then get silver plans for free. So those are things that are focused on getting coverage, but obviously some of that will flow through to providers as well, hopefully with less uninsured patients, balancing, of course, that things like Medicaid don't always pay as well as commercial insurance.
And you mentioned vaccines. Obviously, part of the Biden platform was more support for the vaccine program. How did the ARP address funding and programmatic changes for vaccines?
Yeah, a substantial amount of money. And without going into all the weeds, the American Rescue Plan can't really change, regulations. It has to spend money or cut spending. So a significant amount of spending on vaccines, vaccine research. So kind of taking some of the lessons learned, the RNA vaccines, and hopefully replicating that for other diseases, helping with the global crisis. So hopefully there's less variance over time. And then actually a even larger pot of money for testing, so that the government will continue to help support Americans during this time of transition get not only vaccinated, but get tested to see if they have symptoms as well, and hopefully slow down the spread. So I think it's about 3-to-1 in terms of how much was being spent on testing versus vaccines, which is the flip of what's in the news right now. But there was a view of the testing piece is still very, very important to get Americans kind of understanding where the disease is.
Let's talk for a minute about, go ahead, Wendy.
Oh, I was going to say, I just think that's great news. It seems like with the rescue plan, they've really supplemented what they've done with testing, because through the provider relief fund program, right, they only were covering the uninsured, but now it just seems like they really have expanded it and are understanding that it's kind of a vaccines and testing go hand in hand.
Yeah, I think that's well said.
So there's a piece to the ARP that also addresses some identified holes in our care delivery system. I think, we all learned a lot from the experience in 2020. Our very first guest on the new healthcare headlines was Andrea Lena, our partner, who talked a lot about telehealth.
Right.
But, talk to us, Tim, about how the American Rescue Plan addressed some of those identified holes in the care delivery system.
Yeah, and I think telehealth's a place where Congress is going to want to go, but because of the regulatory environment, they didn't touch it, to be honest, which I think surprised some of us because of how important telehealth is. There's some funding behind the FCC to fund telehealth programs. There's some funding at the USDA for telehealth, but there's not the kind of wholesale changes to the Medicare program that I think some folks maybe thought there would be. Where there was more in terms of, I think, identified holes in our system is mental health care, Amber. And, I think it brought out a lot among Americans kind of knowing that there wasn't the supports maybe that they wanted. And so there is block grants to the state governments to fund mental health and substance abuse, both opioids and other things that have, devastated folks even before this pandemic. And there's also some changes to the Medicaid program in terms of how they stand up kind of crisis centers. And I think that was directly as a response to seeing how COVID impacted people's kind of mental health, not seeing their friends, not being able to do the things that they, enjoy on a daily basis.
So talk insurance, vaccines, testing, lots of different pieces of the American Rescue Plan, $1,400 checks, probably got the most attention early on. What about direct payments for healthcare providers?
Yeah, more provider relief fund money, right? So Congress in the Biden administration didn't do kind of a blank check approach like some have seen the past phases and funding for those phases. So instead, what they did is they put $8.5 billion into a rural specific funding that's going to kind of be provider relief fund money. And one other thing, and I think this probably influenced the design, as part of the year-end spending package, they also directed HHS to put some more money out from earlier, what was left over from the earlier phases of the provider relief fund based on the second half of 2020 and the first quarter of 2021. And, HHS hasn't announced anything there, obviously, based on, kind of the conversation, Wendy, we didn't talk about that earlier. Because we're sitting there, we're waiting. That's one more thing we're waiting on. And I think because of that, Congress, the Biden administration didn't feel like they needed to kind of blanket like they had before. But for rural providers, they felt like there still needed to be some more money. So there will be some more distributions for a subset of providers in our industry.
Got it. Thank you. So we ended the provider relief fund discussion talking about enforcement. So let's talk about enforcement generally. How does the American Rescue Plan address enforcement?
Yeah. So there's money for the Office of Inspector General at HHS, as well as, honestly, at other major departments across the government. And the HHS funding for OIG is going to address kind of some of the different coronavirus related programs, including the provider relief fund. And so, OIG probably will have the resources to do some of the data mining, Wendy spoke about. And then beyond that, Amber, I think, we haven't seen the enforcement. It's all still new. These programs are still rolling out. But certainly, for the insurance expansion, people, people are going to want to put the right information on their forms, obviously the normal stuff that you'd say about government. And then we'll kind of have to see how and where some of the regulatory actors decide to pick up and ensure people are staying where they should.
And I do think another point I just thought of to add there is whether we'll see any type of False Claims Act enforcement through these programs, and just kind of where, since they do have additional funding, kind of where the government will go, and if we'll see any whistleblowers kind of stepping up to report on abuses under the different coronavirus programs.
Yeah, that will be interesting to watch, and a great thing to tackle in the future. I am so grateful to both of you for your leadership in the past year on keeping providers informed. Glad to have you join today and talk about these really important COVID-19 interventions, and look forward to having you both back, Wendy and Tim, to talk about future rulemaking, how the program is unfolding, how providers are facing these challenges, and of course, the enforcement actions. So we will sign off for today, but thank you very much.